Hello, my name's Amy and I look after patient and public involvement at the NIHR Leeds Biomedical Research Centre. I'm joined by a couple of our patient and public involvement and engagement core group members today to talk about how they've been getting involved in activities during COVID-19. So my first question is, how does carrying out online patient and public involvement and engagement compare to in-person activities?
Hi, I'm Sue. One of the things that we've had to learn is new technology using Zoom and Teams, which once you get your head round it can be very useful. It does have some difficulties when the technology doesn't work, but on the whole, we've managed to cope with it quite well. Other good things is that we can get different people attending from outside our local area. So you see new faces on some of the focus groups that you wouldn't have necessarily seen before. And that's very nice because you're getting different viewpoints coming through. One of the other things is that a couple of focus groups that I've been involved in quite recently have actually come in from outside our area. So one was to do with NHS and climate change, and that was a very interesting workshop. So there's lots of opportunity to still get involved, even though we are online.
What were your expectations when you started to get involved in online activities?
Thank you. I'd like to tell you my expectations have been invited to speak online during the pandemic in PPI. I had very few expectations of whether I would be able to cope with it, but I've been delighted that I've managed to take part with very minimal software and apparatus, no computer. I've managed to use a phone to take part and quite enjoyed it, and had a lot of support technically to involve. That's with prompts of when to speak and when to put yourself on mute, and that's helped. So my expectations have doubled, if not quadrupled, in being able to participate, which is the most important point from a researcher's point of view, that members of the public and patients do help as much as they can with research.
Finally, how do you think patient and public involvement activity will look in the future?
Hi, I'm Valerie. I do miss face-to-face, but also it can be a long drive for us, and parking usually is horrendous. So I can see that it would be quite good in the future, especially if we were out of the district, but we're able to get onto our machines. It means that we wouldn't miss, could be a very important meeting.
Thank you very much for joining us today.